Hi everyone, my name is Mia Harris and I did my flashcard presentation on colon cancer. Colon cancer, also known as colorectal cancer, is a disease in which the cells in the colon grow out of control to form polyps. Pathophysiology. Colon cancer is the second leading cause of cancer-related death in the United States. Colon cancer begins with a genetic mutation in the DNA of the colonic cells, which can be caused by environmental factors or genetic predisposition. The mutated cells clump together to form the adenomatous polyps, which are usually benign, but over time these polyps can begin to undergo dysplasia, where the cells can become increasingly abnormal in appearance and behavior. These abnormal cells then undergo malignant neoplasm, where they divide uncontrollably and invade surrounding tissues in the colon. And then they break down the polyps membrane and begin to metastasize. The cancer cells then enter the blood vessels and lymph nodes, spreading to other parts of the body and organs. The most common organs that these cancer cells spread to from the colon are the liver and the lungs. The tumor cells they stimulate the growth of new blood vessels in a process called angiogenesis with the help of the vascular epithelial growth factor. The new blood vessels they promote tumor growth by supplying the tumor cells with nutrient, oxygen, and growth factor that it needed to proliferate. Risk factors for colon cancer. Age is a significant risk factor because the risk of colon cancer increases for individuals over the age of 50. Family history of colon cancer or colorectal polyps increases the risk of colon cancer, especially if it is a close relative, a parent, or siblings that has the colon cancer or polyps. So the risk will increase for any individual that's related to the person that had the polyps. Inflammatory bowel disease conditions such as Crohn's disease, ulcerative colitis are associated with increased risk for colon cancer. Dietary factors, we have foods that are high in red meat or processed meats, foods that are low in fiber, or fruits and vegetables can increase the risk for colon cancer. Alcohol consumption, regular or excessive alcohol intake can increase the risk for colon cancer, as we know that alcohol can irritate the mucosal layer in the GI tract. Smoking tobaccos, studies have shown that smokers have an increased risk for colon cancer. We know that smoking can affect the epithelial cells. Obesity, excess body fat, especially in the abdominal area, produces inflammatory substances. And we know that chronic inflammation is associated with increased risk of colon cancer. Genetic predisposition, family history, familial adenomatous polypopsy, the FAP. This is a genetic condition in which individuals with the FAP genes develop numerous polyps in the colon during their teenage years. The Lynch syndrome, this is caused by a mutation in the genes such as the MLH1, MSH2, MSH6, PMS2. Individuals with the Lynch syndrome have higher risk for developing colorectal cancer and other types of cancer such as the endometrial, ovarian, or stomach cancer. Major signs and symptoms for colon cancer, iron deficiency, anemia, and bleeding. So low red blood cells can be due to bleeding from the colon, and the bleeding can be caused by trauma as fecal material tries to exit the colon that's already affected with polyps and stuff. Obstruction in the colonic lumen. This can be caused by polyps that have grown into large tumors that are obstructing the lumen of the colon. Changes in bowel pattern, such as diarrhea, constipation, or changes in a consistency of stool, can be a sign of colon cancer. Blood in the stool. This is from rectal bleeding or blood in the stool. Either bright red blood or dark blood can be a sign of colon cancer. Abdominal discomfort, persistent abdominal pain, cramps, or gas. On the spleen, weight loss. Significant weight loss, most likely due to poor digestion and malabsorption. Fatigue, chronic fatigue or weakness, lack of energy, and this can also be due to poor digestion of nutrition and malabsorption of the food. Abdominal distension, nausea, and vomiting is a major sign because this is accompanied by a feeling of fullness, bloating, which this can be caused by the tumor. Diagnostic testing, colonoscopy is the primary screening and diagnostic tool. This is a flexible tube with camera is inserted into the rectum to view the entire colon. Polyps can be removed for biopsy during this colonoscopy. Flexible sigmoidoscopy. This is kind of similar to colonoscopy, but it examines only the lower part of the colon. Virtual colonoscopy. This is a CT scan that is used to create a detailed image of the colon. It can be used to detect polyps and abnormality in the colon. Fecal occult blood. This test can be done through guaiac or other method to view hidden blood in the stool. Blood tests. So a blood test can be done such as the carcinoembryonic test. This is a tumor marker for colon cancer. So an elevated level of the carcinoembryonic test will be an indicator for colon cancer. Imaging studies, CAT scan, PET scan, MRI can all be used to examine the extent of the colon and to guide treatment. Alright, this is the end of my presentation. These are my references, and thank you for listening.